One of the most misunderstood processes in dentistry is periodontal disease. Although, if you catch it early enough, you can arrest it and stop it in its tracks. First, I want to talk a little bit about anatomy. If this were a tooth, and this were the bone level on top of it, you know that the bone doesn't want to be all by itself. It has to be covered. So we're going to take a layer of gum tissue, we're going to make a 3 millimeter layer of gum tissue over the top of it, and butt it up right next to the tooth. The gum tissue is attached to the bone. You can't take it off. But the gum tissue is not attached to the tooth, so you can pull it back a little bit. So I can measure it, I can check it, and I can pull it off of the tooth if I need to. What's really cool is if bacteria gets down there, your toothbrush can clean down exactly 3 millimeters. Now that we've given you the anatomy lesson, let's go to the next level. Let's say that you were walking along and you hit a splinter in your hand, and you forgot about it by the time that you were someplace that you can get rid of it. The next day, you went into a door and you opened it, and it hurt a little bit when you opened it. And you looked down and you saw, oh, that's right, there was a splinter there. It's a little bit red, it's swollen a little bit, and it hurts when you touch it. Those are 3 of the signs of inflammation. Inflammation is the body's response to infection. The bacteria in the splinter is the infection. The body's response is inflammation. So first you get the infection, then you get the inflammation. In the mouth, you've got those 3 millimeters. Right at the base of that pocket, you get some bacteria. If you don't get it in time, it's going to cause some inflammation response, and you get a 4th millimeter. But remember, your toothbrush only cleans down 3. So that 4th millimeter is having a great old time. The bacteria are reproducing, the body's inflammatory responses are responding. There's a war between the inflammation and the infection, back and forth. What happens is the bone starts to drop a little bit. The bone is the battle zone. It's the battleground. It will never stop until you actually get the bacteria out. So we've got that 3 millimeter pocket, turns into 4, turns into 5, 6, 7. Pretty soon, the gum tissue starts to slump all the way down the tooth. If it goes down far enough, you will end up losing the tooth. So the big question is, how do you solve this? What are the 5 things that we can do? So we got 5. The first one is do nothing. If you do nothing long enough, you will lose your tooth. It's an absolute. It's a slow process, and it usually doesn't hurt very much. And the first time that you notice that there may be a problem is that your teeth either might be loose or that you might have a little bit of blood on your toothbrush. The next one, you're 20 years old. You get your teeth cleaned twice a year because your mother makes you. That's pretty much all you need because you're young. You can get your teeth cleaned, your 3 millimeter pocket comes back, it might have been 3.5 or 4, it shrinks back down, everything works great. The next one, for those patients that haven't been in a while, what we need to do is clean that area out. But remember I told you that one of the signs of inflammation is pain. So what we want to make sure is that you have no pain at all. We want to get the area numb. So I've got a 3 millimeter pocket, 4 millimeter pocket, maybe a 5, but if I stick something down there, even a probe, something small, it can hurt. What do? We get the area numb. And what we do is we clean 1/4 of the mouth at a time. So for 1 hour, we concentrate with getting you numb, you feel nothing, we get that area clean. Our goal is to get the gum tissue that might be a 4 millimeter pocket to stick to the side of the tooth like wet saran wrap on glass. It seems to be enough to stop the bacteria from going down quickly, but not so much that it would stop my probe from measuring the 4 millimeters down there. We would call that a success, and then we would have you come back a little bit more frequently than twice a year. So that's number 1 is do nothing. Number 2 is get your teeth cleaned a couple times a year. Number 3 is the deep cleaning with anesthetic. Number 4, if that's unsuccessful, surgery is indicated. Surgery, in a nutshell, really is take the gum tissue after you're numb, don't want to have you feel anything, take it off of the off the tooth and of the bone and take a look. There might be a little dot here. We can't feel it, but we can see it. Remove that, because that's bacteria that will cause the inflammation. The bone might be a little jagged. Let's smooth it out. Let's fill it in a little bit. Now take that gum tissue, and that's let's say a 7 millimeter pocket. Let's take some of that gum tissue off and put it down at the base of the tooth again. Our goal here is to make it so that you can clean your teeth by yourself every single day. So if we've got a 2 or 3 millimeter pocket that's maybe a little lower on the tooth, you can clean it yourself. That's the essence, basically, of periodontal surgery. By the way, if you wanted to come in here every single day for an hour and have us clean your teeth, we can do that and you don't need any of that. But it's not practical. So our goal here is to make it so that you can keep your teeth clean on your own every single day by yourself. So I've got basically 4 of them. The 5th one is the one that nobody wants. If you can't do the thing that will keep the tooth able to be in your mouth, get it out. Take the tooth out of there before it starts affecting the other teeth. The big key here is, what I want you to understand is if you get periodontal disease early enough, you can arrest it, you can stop it, and you can take care of it yourself. Thank you.